Poor circulation triples your fall risk after 60. But here's what nobody is telling you. Certain surgeries marketed as safe can permanently damage your body's ability to heal itself. Not temporarily, permanently. And the medical system will not warn you until it is too late. I'm about to walk you through 5 procedures that doctors recommend every single day to seniors. Procedures insurance covers without question. Procedures that seem minor, routine, even life-improving. But after 15 years of watching what happened 6 months, 1 year, 2 years after these surgeries, I can tell you with absolute certainty, the risks far outweigh the benefits for anyone over 60. If this is your first time here, the people who subscribe to this channel are the ones who stopped letting the system make decisions for them. Every week, I go deeper into what conventional medicine isn't telling you. What I'm about to share today is a perfect example of why that matters. Stay with me until the end, because the #1 surgery on this list is performed on over 600,000 Americans over 60 every single year. And a 2023 study found that 47% of those patients experienced complications that were never mentioned during their consultation. Complications that rob them of their independence. I'm Dr. Adrian Volker, a physician specialized in senior health with over 15 years of dedicated clinical experience. I've helped thousands of men and women over 60 navigate the most critical health decisions of their lives. What I'm about to share goes against everything the surgical industry wants you to believe. There is enormous financial pressure to keep operating rooms full, but I've seen it with my own eyes, patient after patient, and I refuse to stay silent any longer. Before we continue, have you or someone you love been told you need surgery? If you're over 60 and a doctor has recommended any procedure in the last year, type surgery in the comments. Let's see how many of us are facing this decision right now. Here is what is happening inside your body right now. After 60, your body produces 40% less collagen, the protein that helps wounds close and tissues repair. Your immune system becomes 35% less efficient at fighting infection. Your circulation slows, meaning oxygen and nutrients reach surgical sites far more slowly than they used to. Blood vessels become more fragile. Bone density decreases by up to 1% per year after 50. This isn't just about slower healing. When you combine anesthesia exposure, surgical trauma, infection risk, and reduced healing capacity, you create a perfect storm. A storm that can trigger a cascade of complications the surgeon never mentions in that 5-minute consultation. And here's what concerns me most. The medical community measures surgical success by whether you survive the procedure and the immediate recovery period. They don't track what happens to your independence 6 months later. They don't measure whether you can still climb stairs, drive to the grocery store, or live without chronic pain. If this information seems valuable, hit that like button right now. Let me walk you through the 5 surgeries I would never, under any circumstances, allow someone in my family to have after 60. F-cased. We're going from concerning to absolutely dangerous. Surgery number 5. Arthroscopic knee surgery for osteoarthritis. This is the procedure where a surgeon inserts a tiny camera and instrument into your knee joint to clean up damaged cartilage and smooth rough surfaces. It sounds minimally invasive. It sounds logical. Your knee hurts, the cartilage is damaged, so remove the damaged parts. Wrong. Osteoarthritis isn't caused by loose pieces of cartilage floating around. It's caused by the progressive breakdown of the joint itself. A 2017 study published in the New England Journal of Medicine followed 351 patients over 45 who had arthroscopic knee surgery for osteoarthritis. The results were striking. 2 years later, patients who had the surgery reported the exact same pain levels as patients who received only physical therapy. Exact same. But here's the part that concerns me most. The surgery creates additional trauma to an already compromised joint. It exposes you to anesthesia risks. It creates scar tissue. And in 22% of cases, patients reported their knee felt worse after surgery than before. The alternative? A combination of targeted physical therapy, anti-inflammatory nutrition, and specific supplements like glucosamine and chondroitin has been shown to reduce knee pain by up to 38% within 3 months. No incisions, no anesthesia, no surgical complications. Here's something most people miss. After 60, your body has an incredible capacity to adapt and compensate, but it needs the right support. Surgery interrupts that process. It forces your body into emergency repair mode when it should be in gradual strengthening mode. Surgery number 4, spinal fusion for lower back pain. This is a major procedure where surgeons permanently join 2 or more vertebrae using metal rods, screws, and bone grafts. The promise is simple: eliminate movement between painful vertebrae and eliminate the pain. I remember Barbara, a 68-year-old retired teacher from Atlanta. She sat in my office 6 months after spinal fusion surgery with tears running down her face. Before surgery, she had chronic lower back pain that made gardening difficult and long car rides uncomfortable. After surgery, she couldn't bend to tie her shoes. She couldn't twist to check her blind spot while driving. She had to sell her 2-story home because climbing stairs had become unbearable. Her surgeon told her she'd be good as new in 3 months. What he didn't tell her was that fusing vertebrae transfers stress to the joints directly above and below the fusion. Research published in the Journal of the American Medical Association found that within 5 years of spinal fusion, 38% of patients develop serious problems in adjacent vertebrae, problems that often require additional surgery. And here's the comparison that should make every senior pause. A 2019 study took patients over 60 with chronic lower back pain and split them into 2 groups. Half received spinal fusion, half received intensive physical therapy, core strengthening, and pain management. After 2 years, both groups reported similar pain levels, but the physical therapy group maintained far better mobility, experienced 0 surgical complications, and saved an average of $87,000 in medical costs. Barbara's outcome wasn't inevitable. It was preventable. After months of targeted rehabilitation and nerve support protocols, she regained about 60% of her pre-surgery mobility, but she will never be fully whole again. The fusion is permanent. Surgery number 3. Gallbladder removal for symptom-free. Gallstones cholecystectomy. That's the medical term for removing your gallbladder. Over 600,000 are performed every year in America. And here's the problem. Many seniors are told they need the procedure simply because a scan found gallstones, even when those stones are causing absolutely no symptoms. Let me be direct about this. Your gallbladder has a job. It stores and concentrates bile, which helps you digest fats and absorb fat-soluble vitamins A, D, E, and K. Remove it and your body loses that concentrated delivery system. Or research published in Frontiers in Aging shows that up to 40% of people over 60 develop gallstones at some point. But here's the critical piece. Most of those stones never cause a single problem. They sit quietly for decades. The medical term is silent gallstones. Studies show that only about 20% of people with silent gallstones ever develop symptoms. That means if you remove your gallbladder just in case, you have an 80% chance you're removing a functioning organ for no medical reason. And what happens after removal? Research from 2021 found that 47% of patients who had their gallbladder removed experienced chronic digestive issues afterward, diarrhea triggered by fatty meals, bloating, difficulty absorbing nutrients. For seniors, nutrient malabsorption can accelerate muscle loss, bone density decline, and cognitive impairment. Oh, these are not minor inconveniences. If you have gallstones but no symptoms, no pain, no inflammation, the answer is not surgery. The answer is dietary modification. Increase fiber, reduce saturated fats, stay hydrated, support bile production with dandelion root and milk thistle. After 60, preserving every functioning organ is the priority. Remove one piece of the system and you create imbalance everywhere else. Have you been told you need surgery for a condition that isn't even causing symptoms? Share your experience in the comments. I read everyone. Surgery number 2, coronary artery, bypass for stable angina. This is open heart surgery. They open your chest, stop your heart, connect you to a bypass machine, and graft blood vessels from other parts of your body to route around blocked coronary arteries. It is major. It is traumatic. And for many seniors with stable angina, chest discomfort that is predictable and controlled with medication, it is completely unnecessary. Let me tell you about James, a 74-year-old retired engineer from Phoenix. He had been managing mild chest discomfort with medication for 2 years when his cardiologist told him he needed bypass surgery before something bad happens. James was terrified. He scheduled the procedure. 3 days before his surgery date, he came to me for a second opinion. I reviewed his records. His angina was stable. His ejection fraction, the measure of how efficiently his heart pumps, was 52%. Normal range is 50 to 70%. He was active. He walked 2 miles every morning. I told him to cancel the surgery and put him on a comprehensive program instead. Intensive cholesterol management with targeted supplementation. Our anti-inflammatory nutrition centered on omega-3s and antioxidants. Stress reduction through meditation. Controlled exercise rehabilitation. 6 months later, James came back. His angina episodes had decreased by 60%. His cholesterol profile had improved dramatically. His energy was better than it had been in 5 years. He told me, Dr. Volker, I almost let them crack open my chest. I can't believe how close I came to making the biggest mistake of my life. This wasn't luck. This was evidence-based medicine. A landmark study called the Courage Trial, published in the New England Journal of Medicine, followed over 2,000 patients with stable coronary artery disease. Half received bypass surgery or stenting, half received optimal medical therapy. After 5 years, there was no difference in death rates or heart attack rates between the two groups. None. For stable angina, invasive procedures provided zero survival benefit compared to medication and lifestyle modification. But here is what concerns me most about bypass surgery for seniors specifically. Studies show that up to 50% of patients over 70 experience significant cognitive decline after open heart surgery, likely due to time spent on the heart-lung bypass machine. Some recover. Many don't fully. You are not broken. Your treatment plan is broken. Before we get to the most dangerous surgery on this list, 2 quick things. If what you've heard so far is valuable, share this video with someone you know who is facing a surgical decision. A single conversation could genuinely change the outcome. And if you want to keep receiving this kind of information, the research your doctor isn't referencing, the alternatives the system isn't presenting, this channel is where that lives. Subscribing means you won't miss it. Surgery, number 1, total hip replacement for moderate arthritis pain. This is the one. Over 450,000 Americans have hip replacement surgery every year, and the majority are over 60. It is marketed as a miracle cure. The before and after testimonials are compelling. And for a specific subset of patients in genuinely severe situations, it does improve quality of life, but here is what they don't tell you during that polished consultation. A total hip replacement is exactly what it sounds like. They saw off the ball of your hip joint, they hollow out the socket, they hammer a metal stem into your femur. They attach a metal or ceramic ball. They line your hip socket with plastic or ceramic. You now have a completely artificial joint. And that artificial joint has a lifespan. Research shows modern hip replacements last an average of 15 to 20 years. For someone who has a surgery at 65, that means revision surgery at 80 or 85. Revision surgery, where they remove the old implant and install a new one, is far more complex, far more dangerous, and carries far lower success rates than the original procedure. A 2022 study in the Journal of Applied Physiology found that revision hip surgery in patients over 80 carries a complication rate of 28%. Infection, dislocation, fracture, blood clots, death, 28%. But here's what really concerns me. The vast majority of seniors who get hip replacements have moderate arthritis pain, not severe disability. They are still walking. They are still functioning. They have discomfort, yes. Limited range of motion, yes. But they have not exhausted conservative treatments. I remember Patricia, a 69-year-old retired nurse from Seattle who loved hiking. Hip arthritis was making her favorite trails harder. Her orthopedic surgeon showed her x-rays and said, "You need a new hip. The sooner the better." She came to me conflicted. I asked her one question. "Can you still do the things that matter most to you, even if they're harder than before?" She thought about it. "Yes, it hurts. But yes." I told her to hold off. I designed a comprehensive program, daily glucosamine and chondroitin for cartilage support, curcumin for inflammation, targeted hip strengthening to stabilize the joint, low impact activities like swimming and cycling, weekly acupuncture for pain management. 3 months later, she came back in tears. She said, "Dr. Volker, I'm back on the trails. I move slower, but I'm there. I almost traded my real hip for a metal one. Thank you for giving me another option." The science backs this up. A study published in the Nutrients Journal found that a combination of glucosamine, chondroitin, and collagen supplementation reduced hip pain by an average of 43% within 12 weeks in patients with moderate osteoarthritis. Another study in the Journal of Clinical Nutrition found that seniors who engaged in daily low-impact exercise and took omega-3 supplements experienced pain reduction equivalent to non-steroidal anti-inflammatory drugs without the gastrointestinal bleeding risks. Most orthopedic surgeons don't present these options. They are trained to operate. The system incentivizes surgery over conservative management. And here is what nobody talks about. Hip replacement changes how you move for the rest of your life. You cannot cross your legs. You cannot squat fully. You cannot pivot aggressively. You carry permanent restrictions from the moment you wake up in recovery. This is not just aging. This is accepting an irreversible intervention when reversible options haven't been fully explored. Now, let me give you exactly what to do with this information. If you've been told you need any of these surgeries, here is your action plan. First, get a second opinion, not from another surgeon in the same practice, from an independent physician who does not benefit financially from your decision. Ideally, someone trained in both conventional and integrative medicine. Ask these specific questions. What happens if I do nothing for 6 months? What conservative treatments haven't I tried yet? What are the specific risks of this surgery for someone my age? What percentage of your patients experience complications? Will this surgery improve my lifespan or just manage my symptoms? For daily joint support, here is what the research supports. In the morning, 1,500 milligrams glucosamine sulfate, 1,200 milligrams chondroitin, 500 milligrams curcumin with black pepper for absorption. In the afternoon, 20 minutes of low-impact movement, swimming, cycling, tai chi, or gentle yoga. In the evening, 2 grams omega-3 fish oil, 10 grams collagen peptides, mixed in water or tea. What to avoid? Do not rush into surgery because a doctor uses fear tactics. If they say you need this now or you'll be in a wheelchair, that is the moment to seek another opinion. Do not assume pain automatically means surgery. Pain is your body communicating, not a surgical directive. Do not skip conservative treatment. Surgery should always be the last option, not the first. What to expect on a consistent conservative program. Within 3 days, reduce morning stiffness. Within a week, improve sleep quality as pain decreases. Within 2 weeks, measurable improvement in range of motion. Within a month, your doctor will be surprised at your follow-up. Consistency is everything. You cannot take supplements sporadically and expect repair. You cannot exercise once a week and rebuild strength. This is a daily commitment. The same way brushing your teeth is a daily commitment. The difference is the stakes are much higher. If you believe conservative treatment deserves a real chance before surgery, type yes in the comments. If you think surgery is always the answer, type 0. Your response helps other viewers know they are not alone in questioning the system. So we've covered 5 surgeries that carry hidden dangers for anyone over 60. Arthroscopic knee surgery for osteoarthritis that doesn't reduce pain long term. Spinal fusion that trades one problem for several new ones. Gallbladder removal for stones that may never cause a single symptom. Coronary bypass for stable angina, that medication manages just as effectively. And hip replacement for moderate arthritis that conservative care can dramatically improve without the permanent consequences. Each one has been marketed as routine, safe, life-improving. But when you look at the long-term data, when you track independence and quality of life 6 months, 1 year, 5 years out, a very different picture emerges. My message is not to panic. It is not to reject all surgery. It is to be empowered. You now have information most people never receive. You know the questions to ask. You know the alternatives to explore. You know that pain does not automatically equal a surgical indication. Here is my challenge to you. Commit to giving conservative treatment a genuine 90-day trial before agreeing to any elective surgery. Just 90 days. Track your pain daily. Notice the changes. Document the progress. Your body's capacity to heal will surprise you. I think about Patricia back on her trails, about James still walking his 2 miles every morning with his chest intact, about Barbara, who learned too late that some decisions cannot be undone. You have the power to choose differently. If this video was valuable, share it with someone you know who is facing a surgical decision. You might just change the outcome of their life, and if you want to keep receiving this kind of information every week, the research, the alternatives, the questions to ask, subscribing is how you make sure you don't miss it. Tell me in the comments, which surgery on this list surprised you most, or have you already had one of these procedures? Share your story. I want to hear it, because aging doesn't take away your body's ability to recover. It simply reminds you to care for it the right way. And sometimes the most powerful intervention is choosing not to intervene at all. I'm Dr. Adrian Volker, and your health is the only metric that matters. I'll see you in the next consultation.